This is the second video in the series of menopause. Now, in this video, we will understand how we diagnose the menopause. I already told in the first video that cessation of period, just cessation of the period that doesn't mean that menopause. The cessation of period is because of ovarian failure. That's why we call it menopause. So what happens? What are the symptoms there in the menopause? Hot flushes, dry vagina. Because of the dry vagina and alkaline environment of vagina, which was acidic when there is a time of estrogen. Now the estrogen levels are so down, that's why the vaginal environment becomes alkaline, and that's why it's more prone to infections. So vaginal infections are there, urinary problems are there because urethra is also associated with vagina and mucosa. Because of the bone loss, we have higher chances of fractures, and because of the estrogen and progesterone cyclic pattern is lost, the endometrium that present is not well cyclized. That means endometrium doesn't get enough progesterone or enough estrogen. That's why it sheds irregularly. So in many women, it's a very common thing that a menopausal woman, a perimenopausal woman have abnormal bleeding, uterine bleeding, because of the endometrium is not in control of this cyclic pattern of estrogen and progesterone. If we investigate this kind of cases, we find that the estrogen levels goes less than 20 picogram per ml, and progesterone also goes down, inhibin also goes down, FSH increases, LH increases, testosterone remain almost the same. One thing is AMH, that is anti-Mullerian hormone. AMH is a marker of ovarian reserve. It also decreases. Now, if we do the USG, that is ultrasound of the pelvis, if we see the ovary, we can find that they are silent. They have no follicular activity, which is very important in reproductive age. If we see the uterus is also hyperplastic, because estrogen and progesterone are the hormone which are responsible for a well growth of uterus, and if we lost estrogen and progesterone, the uterus is also goes down in the size and becomes hypoplastic. So these are various investigation. Vaginal cytology, if you talk about, the maturation index is 100 0 0. That means no estrogenic, no progesteronic environment. Dry pink vagina with alkaline pH. This is what exactly the menopausal vagina looks like. That's why these are investigation we can see for diagnosis of menopause. Thank you.